This is Jimmy Red, and I would like to teach you a little bit today about the American Rescue Plan and its impacts on your health insurance coverage and available premiums as well. So the American Rescue Plan was passed in March of 2021, and that plan has made insurance premiums way cheaper, far cheaper, and far more affordable for lots and lots and millions of Americans. You will see your insurance premiums be cheaper whether you are a current ACA or Affordable Care Act or Obamacare client, whether you have an existing plan or whether you don't have an existing plan and you want to apply for a new one. So what I'm recommending to all my clients, whether you're a current or you're a potential client, is to go ahead and review your coverage during this period to see how your insurance premiums might change. And if you want to change your plan or if you want to sign up for a new plan, now is the time to do it. Everybody should be doing this right now during this period. And the period lasts until August the 31st when you have the ability to enroll in a special enrollment period for these plans. Okay, so first off, let me show you a few details, run you down a few details about how this plan has impacted health insurance premiums as well as coverage options to you. So the number one way is that the new healthcare law has enhanced subsidies for insurance premiums. What does that mean? The government basically pays part of your insurance premium based on what your income is right here. So if, let's say, in November of last year, you were paying $200 for a plan, this year you might be paying half of that. This is an email from the healthcare.gov marketplace here, which is run by the government here. It says, on average, customers are going to save $50 to $85 per month on their policies. It says an average of 4 out of 5 consumers who are looking at policies now are going to find a plan that is $10 or less per month. And an average of 3 out of 5 uninsured adults are now eligible to access a zero premium plan, and nearly 3 out of 4 may find a plan with $50 or less. So look at that right there. That's far cheaper than it was going to be before. Also, there used to be what was called a subsidy cliff. So people who were earning over $51,000, for instance, right here at the bottom of this page right here, you'll see these 400% plus income range of people who were earning, in this case here, if they were single, $51,040 or more. The subsidy cliff happened. Those people got no help and assistance, so they were seeing premiums, $500 to $1,000 range, and the premiums were unaffordable. Now with the new plan, they're getting assistance and their premiums are going to be far cheaper than they were before. People who were within 100 to 150% of the poverty level, they were having to pay about 2% to 4% of their insurance premiums. Now they're paying 0%. So these people who were paying something for their insurance coverage now are paying nothing for their insurance coverage. 0% of their income. So, and then likewise, you see what percentage people were paying over here on this side. Now look at the percentage they're paying. So it's cutting insurance premiums in half, basically, for a lot of people, or making them nothing for a lot of people. So if you had a plan at that point, what you need to do is to recalculate your premiums so you can get this new rate right here. Even if you already have an existing plan, you need to call me and get me to recalculate your premium so you can earn that cheaper rate. So let me show you an example. This is my website right here, healthsherpa.com. And if you log in here, you can see healthsherpa.com and my address up here. You can also find this on my Red Family Insurance Facebook page. You type in your zip code and your name and your email, you can see the plans and prices and what your rate's going to be. So I went ahead and ran a quote right here for somebody who is 37 years of age. Let me show you. Let's say this person earns $20,000 in income and he is single. It looks like I'm going to have to log back in. Okay, let's say this person is 20. Let me recalculate this right here. Give me just a sec. We got a 37-year-old individual who is single, living in Winston County, Mississippi. 20,000 income. Look at this premium, $0 a month. Deductible, $0 a month. That's for Molina. I like Ambetter of these two companies that are available in our area. That's the one I sell the most of. You got $0 premiums with these astronomical deductibles here. I don't recommend those. Just scroll down just a little bit and you'll see these silver plans. So there's a $12 premium right there with a $0 deductible right there. So why not go ahead and get that coverage right there? Look how much cheaper it is now than what it was. Or a $4 premium with a $950 deductible. Even that is really good. So look at that right there. Wow. Boom. Why not get that right there? And you can do that by contacting me. You can email me, message me on Facebook, and I will get you a new premium. Even if you have an Ambetter plan or a Molina plan, I can recalculate these premiums for you. You need to get me to go in here and recalculate the premiums so you can start earning that insurance coverage. For instance, I had somebody who was paying $300 the other day. I recalculated her premium. Now she's paying $100. Okay, I sold 3 of these policies yesterday. One of them was $0, one of them was $17, and one of them was $47 yesterday. All of them had $0 deductibles. And some of them already had coverage. They just called me and I recalculated the premium for them so they could start earning that savings. Okay, so the other things to note right here, to kind of see, it all depends on your income and how big your family size is going to be, what the premium is going to be. So let's say you make $30,000 a year, and you have you're married but you don't have any kids. Okay, and only you want to apply for coverage. So the premium is going to change a little bit there because you earn more money. Okay, so that's $32 a month with a $0 deductible there. A little bit more right there, but still very affordable right there. Or let's say your spouse wants to apply. If your spouse wants to apply, there's a $40 plan with a $0 deductible that'll cover both of you right there. Or let's say we want to add some kids. You got a kid, she's 4 years old. Right there, the kid should be on CHIP or Medicaid. That's what it says right there. You can apply for Medicaid, free Medicaid through Mississippi right there for the child. But you and the spouse can still get, look right there, $16 coverage right there. So the coverage depends on a couple of different factors. It depends on where you're located, how many people are in your tax household, and how much income you earn before taxes. Those are the main things that determine what your premium is right there. Previously, people who were earning a really high, a lot of money, they had what was called a subsidy cliff right there. So previously, if somebody was earning $52,000, they weren't earning any subsidies at all. They were having to pay for full coverage. But so they were having to pay. See where that it crosses out right there, $420 a month. But now with this new coverage right here, see it's $100 cheaper right there. Now this person though, when you get higher up in your income, they're not receiving any help on these deductibles, so the deductibles are really high. So for clients like that, I say don't worry about that because I have what's called a gap plan, or I have other plans that can pay those deductibles based on certain things. For instance, let's say you get this plan right here, $376 a month with a $6,000 deductible. I can sell you a gap plan that will pay $6,350 if you are hospitalized overnight in a hospital. And I also have a plan that can pay, see the doctor visits, the copays over here, the $30 right there. I have a plan that can pay $50 for a doctor visit. So I can customize a gap plan to take care of these high deductibles and out-of-pocket expenses. And I sell those gap plans whether you have an Affordable Care Act plan or not. For instance, I have a Blue Cross Blue Shield plan through my employer, and I have sold myself a gap plan to pay my $5,000 deductible right there in case I go into the hospital because I don't have $5,000 in the bank. So I want you to check out my other website right here. This is my Manhattan Life website. A couple of things I want to say about this right here. First off, I don't recommend marketplace dental or vision coverage. I don't recommend you signing up for dental or vision coverage through this website right here. What I recommend is you go into my Manhattan Life website right here. You can see the URL right here. And when you're there, you can find quotes for dental and vision and also these gap plans I was talking about. Or if you want alternatives to the ACA marketplace coverage that I was just showing you, then you can find some right here. The benefits of using this dental plan instead of the marketplace plan is that the dental plan I sell here, you can use any dentist you want. With the some of the marketplace plans, for instance, there's only one dentist in our whole area that you can use, or only one dental office that you can use in our whole area. So that's very restrictive. And so people don't like that. So I recommend this plan here, and you can just click on Start Quote here and you type in your zip code. Type in the effective date, view our available products. So these are the different products that I offer on this website here. The gap plan, the dental and vision plan is right here. You can click on that and you'll see there's three different plans that I offer. I offer a $1,000 benefit, $1,500, or $3,000. I would recommend either getting the $1,500 or the $3,000 benefit right there. But if you're just using dental coverage and you don't expect to go to the dentist very much, then the $1,000 benefit might be a good choice. So right here, $39 for me, for instance, I just quoted myself. You can look at that plan and the brochure right here by clicking right here. As you see, this product brochure, you can choose your own dentist. There are no networks. You go in or out of network. It's guaranteed issue. You get it no matter what. That's the biggest benefits of it right there. And you'll see the premiums based on age and what whether you want the low, high, or medium option right there. It's got a $100 yearly deductible, and then it pays a percentage after that deductible. It gets better the longer you keep it. It starts at 60% the first year, 70% the second year, and 80% the third year. So by that third year, this pays a lot better than my employer plan. So that's why I have one of these plans in addition to my employer plan. It does have a waiting period on some major services like 6 months on eyeglasses and 12 months on big stuff like bridges and crowns and full dentures and stuff like that. But you can go ahead and start using it for preventative services and x-rays and fillings and stuff like that upon its effective date. The other thing that I have here that you might want to check out is, well, there goes my website. The other things I have on there is you can look at, have some alternatives to ACA plans. If the ACA plans are, if you're not getting a subsidy and they cost too much for you, then I can get you a quote on something different. Or if you want one of those gap plans, then I can show you what those look like. So the gap plan is this out-of-pocket protection plan down here. And you can tailor your out-of-pocket protection plan based on the gaps that are in your ACA plan or in your employer coverage right here. So I would click the $200 a day benefit there. Let's say you got a $6,000 deductible. I would click this first hospital admission benefit right here, $6,350 right there. And that way, if you're admitted into the hospital, boom, it pays $6,300 right there. You've met your deductible, or they'll send you actually a check in your name, and you can spend that money however you want. You can pay the hospital with it, or you can go, whatever you want to do with it. You can pay for hotel, room, board, whatever. You just deposit it in your account and use it. You can add on a couple of different riders. You can add on outpatient surgery benefit for $1,000 or $2,000, $3,000, however you want to do. Just depends on how much money you want to spend right there. You can add on an emergency accident benefit. You see the total of how much that gap protection is worth right there. And it will pay based on only those services that you selected. In addition, it pays a $50 benefit for going into visiting a doctor for an illness. It does that twice a year. I'm going to pull up the brochure here. So here's the brochure for the GAP plan, also called an out-of-pocket protection plan. So you choose these different benefits. There's a 2 per year doctor office visit, $50 there that would cover that copay that I showed you. And the $6,350 right there, that'll cover if you're admitted into the hospital, which is the biggest expense that you could possibly incur. It'll cover $6,350 right there. They'll send you a check for that. So let's say your deductible $6,000, boom, you've met it right there. And it'll pay for these other benefits. Okay, my friends. Well, I hope that shows you a lot of cool stuff that you can do with my website and some different coverages that you should check out right here. If you want me to, message me and I will recalculate your premium, tell you how much your new premium is going to be now that the law has been passed. Whether you already have existing coverage with an ACA plan or whether you're interested in getting a new one, I'll definitely help you out with that. Just give me a message or give me a ring at 662-416-0302. And I'm Jimmy Red. And go ahead and give me that now before the special enrollment period ends. Thanks for listening, my friends. Chat later.